Hi, welcome to another episode of the Edmonds Mom's Room podcast. This is Dr. Allison Feldt, pelvic floor physical therapist and owner of Body Motion Physical Therapy here in Edmonds, Washington. So I am so excited to talk to you today a little bit about incontinence. So we're going to talk about urinary incontinence, and we will save fecal incontinence for another episode. So urinary incontinence, this is peeing your pants anytime that you don't want to be peeing your pants. So this could be you sneeze and you leak a little bit, or this could be that you have to go to the bathroom. You just get these urges and you're like, I just went to the bathroom. Or you go to the bathroom and you're like, I thought I had to go to the bathroom, and you only pee a couple dribbles. That's called urge urinary incontinence. So these are, you can have both. You can have your urge urinary incontinence, and then you can have stress urinary incontinence. And stress urinary incontinence looks more like you are sneezing or coughing or laughing, and then all of a sudden you pee. And so I put it to you this: if you have to wear a panty liner, or even if you dribble a little bit in your underwear and you just deal with that, you're used to your peeing a little bit. That's just been your whole life. And then I put it to you that there's a bigger problem at play, that your pelvic floor is not working for you in some regard. There can be other things going on, and at that point you would go to your physician. So the reason it's important to know whether you have urge urinary incontinence or stress urinary incontinence is because you need to know that your pelvic floor is not working. And if you have had incontinence longer than just a few days, you really need to get help. Because depending on how old you are, you don't want to have to go through menopause and then try to get help. Or maybe you're just going to be okay taking a pill. Maybe you're going to a urogynecologist, or your doctor is like, oh, take this urinary pill. This will keep you continent. And maybe that helps a little bit, but we have to be honest, we're just not getting to the root cause of the problem. And so in America, we all know, doctors like to give pills because that's the tools that they have. So they can support us with pharmaceuticals, or they can support us with surgery. And those options all have side effects, and not necessarily good ones. So I want you to know that if you suffer with urge urinary incontinence or stress urinary incontinence, you can get help naturally, drug-free, surgery-free, with going to see a pelvic floor physical therapist. We have some great tools to help you really become continent. And you might think, man, but who cares? I just pee a little bit. And that's what a lot of people coming to us actually say. They're like, that's not really the reason I'm here. I'm here because I just want to make sure my pelvic floor is working well. I do pee a little bit, but it's not that big of a problem. But, people will say, I've heard you say that if you do pee a little bit, that means that you're going to wear your joints out faster. And I say, yes, that does mean that. So if you do pee and you leak urine when you don't want to be leaking urine, your pelvic floor is not working. And I've said this before, and I'll say it again. Your pelvic floor is an essential muscle in your core. And if your core is not working, then your joints take up a ton more force than they need to. So it is important that you know how to work this pelvic floor, because it is essential in keeping you healthy for life. So I'm going to talk a little bit about why incontinence is such a problem. And I think it's just underreported. The last stat I've seen all the way of 40 to 60% of women are incontinent postpartum. So after babies, there's a lot of different statistics out there. So I'm not really going to get into the statistics of it. And I think it's just completely underreported. But I am going to tell you that what incontinence leads to and why it's such a big deal is because you want to save your joints. You want to save your body from what could happen in the future. If you're premenopausal, what an amazing time to deal with this incontinence, because you have estrogen on your side. Postmenopausal, there's still things that we can do, a ton of things. We just don't have estrogen. And for women, estrogen is a lubricant. Estrogen helps keep the muscle nice and soft. Estrogen is a skeletal muscle builder for women. And so estrogen plays a lot of roles for women. And after menopause, there's just not a lot of estrogen, so things dry out and they become a little less soft. The pelvic floor doesn't work quite the same after menopause, but it can. People just don't use it. And so if you don't use something, then you tend to lose it, right? So if you don't use it, you lose it. That's a common saying. And the same is true with the pelvic floor. And most people actually never even are taught how to use their pelvic floor or what their pelvic floor should be doing. And so you don't know how to use it. So of course it's going to go away if you're not using it and intentionally knowing how to control it. So that was a little tangent I went on. But I want to tell you about this conversation I had with someone who works retirement home. So it's independent living, but retirement home. And it brought up so much for me to talk with her last week. She popped into the office and she's like, is there anything you can do for my residents? Because I think every single one of them is in diapers. Every single one pees. And you know, when it gets to that point, I said, yes, of course, there's a million things we could do, but they're problemless. So the things that they have going on is so extensive. They're on so many medications that do affect their bladder and all these other things that it becomes that much more difficult. It becomes that much lower on the problem list. So, you know, you're dealing with people that have heart conditions, diabetes, all these things that affect bladder as well and affect continence. So dealing with it in those elder years is just so much harder and all of a sudden becomes so much less significant. I'm not saying that it should be. I'm just saying that when you know, a heart attack is going to kill you. Peeing your pants is not going to kill you that day. So that's where it becomes less of a problem. But I want to talk about why this conversation brought so much up for me. And it really came down to the fact of, and I've seen it time and time again when I used to do some geriatric care. You know, you have people that they've been living with back pain for a long time. Maybe they become, you know, debilitated because they just don't move as much because their backs hurt. And when their back was hurting, their pelvic floor was not working. And, you know, that was an essential piece of their core that was not working. So they become less mobile. They sit in wheelchairs. They sit in recliners. And they just don't move as much. Actually, at that point, it's like, who cares what's happening with the pelvic floor? Their circulation is going to be bad. Of course, they're going to be in danger because they're not getting any cardio. They're just declining, right? These people are declining. So what's happening is that they're peeing their pants all along while declining and becoming less and less mobile. So then they end up getting wounds. They end up getting bed sores. They end up getting, their skin is raw from peeing their pants so much, and so they get wounds. And wounds can kill you, right? So that was a little aggressive for me to say, but wounds really, once they happen, it's hard to heal, right? And then if you're just peeing your pants all on top of that, it's just continual contamination, difficulty keeping the wound dry, and all the things. So I put it to you this way, and I'm so passionate about this, right? Because I see how the pelvic floor affects life across the lifespan. And I just know if you can get people utilizing and working their pelvic floor, maybe, you know, and this is prenatally, if you can do this is going to help you get pregnant, but that's another episode. If you can utilize your pelvic floor and know how to use it, this is going to help you through pregnancy. This is going to help you through delivery. And this is going to help you in the years to come so you can be active, independent, and mobile and not have to live this like decline life, right? And so much of that is just like, let's start from the basics. Let's start from the pelvis and work our way out. Know how to work your pelvic floor, have everything else moving, and then you won't be sitting in a wheelchair. You won't be peeing your pants, you know, and that's not what's going to end up killing you. So this conversation with this woman from the retirement home, it was cool because I was like, yes, we have to expand what people know. We have to really tell people that incontinence could kill you. Incontinence is a problem. And, you know, we want you to deal with this, even if you're a 30-year-old mom or 40-year-old mom and you're like, I don't really have time for it. I don't really care that I pee my pants. And I just want to put it to you this way. Like, yeah, that's fine now. But if you don't deal with this, it's not pretty. And it ends up, it's not great. And so that's why I become so passionate about what I do is so I can just help you age better, age with grace, and, maintain your mobility and do all that stuff. And you might not think incontinence matters, but again, it's just your pelvic floor is not working in the way that it should. And if that's happening, then that's affecting your joints. That's affecting everything else. So deal with the incontinence. So this conversation with this woman, it really just brought to my attention that we just need to tell people that this is what happens if you don't take care of business. This is what your life is going to look like. Because I think it's easy to be like, oh yeah, if only we could have prevented it in these people. Well, let's not talk about that now. There's nothing we can do as far as prevention now for them because they're already, living the problem. So that's why all my passion and effort is really around pregnancy and postpartum. And once you're postpartum, you're always postpartum. And so I put it to you this way, just if you're having incontinence, whether it's urge, whether it's stress incontinence, whether it's both, maybe you just pee only when you're sick, that still counts. And let's help you figure out what's happening, and let's help you figure out how we can keep your pelvic floor healthy, happy, and working for you. So I'm going to end this episode with just telling you what is normal bladder health, so you can have some idea of normalcy, and you can kind of decide whether you fit that norm. And if you don't, then definitely seek some help. So the normal bladder can hold 2 cups of urine before being emptied. So that's normal bladder capacity for an adult. And the normal person, so normal range of voiding, so getting urine out of your body, is 6 to 8 times per day during a 24-hour period. As you get a little bit older, your bladder capacity does get smaller. And so you might need to pass urine more frequently, but usually never more than every 2 hours. And when I say older and your bladder capacity shrinking, I'm talking about postmenopausal women, and I'm not talking about being in your 40s. So that is considered what a normal bladder should do. The urine should leave your body with ease. There should be no straining involved. It should just flow out of your body. There's no pushing, no straining, and it just leaves. It's easy to leave. There shouldn't be any dribble left on the toilet seat after you're done. And once you feel an urge, so your bladder has signaled that it's full with urine and it tells your brain that you have an urge, you should be able to delay that urge. So urges aren't commands to go to the toilet. They're merely just a signal, and you should be able to control that. And now this is for urination, remember, because this is different for bowel habits. So pooping habits, this is completely different. So for bladder habits, you should be able to delay the urge. Talking about what good bladder habits look like is good bladder habits means that you take your time to empty your bladder. Yeah, we tend to bring our phones to the toilet these days, but sit down, relax, don't strain. Just gently open your pelvic floor, gently breathe, and you should just be able to pee. You should make sure that your bladder is completely empty, and so you don't want to rush the process. You don't want to have residual pee left in your bladder. The goal is to empty as much as possible without straining or pushing. And then it's important to know that you shouldn't consistently ignore urges to go. So if you're waiting more than 4 hours, I see this sometimes in teachers, they wait like all day long to go pee, and then, all of a sudden that can mess things up a little bit. So that can stretch the bladder out, and then that can change the signals. Urinating with too much infrequency is not great for the bladder either. That can cause some problems. And so the biggest thing I want you to get from this podcast is avoiding going to the toilet just in case. So you don't want to go more than every 2 hours. And so even for your kids, I put it to you this way, even if you're potty training, don't have your kid go to the potty just because you're going to the park, okay? You want to avoid going just in case, because we start to train this even in our kids early on in life. And we've all been trained. Go to the potty just in case. Go pee just in case, because we're going on a road trip, right? So you do not want to go more than every 2 hours, and going just in case is going to mess things up for you. So It is usually not necessary to go to the bathroom when you first get an urge. So you want to really try to only go when your bladder is full. And so urgency and frequency of your urination can actually be improved. And same with spacing your fluids out throughout the day. That can really help change the urgency and frequency. So I hope that this helps you practice some great toilet habits, and also not just you, but helps your kids. And if you want this in a written out form, we have some great tips, and we would be happy to send that to you. So you can just reach out to us at bodymotionpt.com. And so we have that available for you. So these are some good, healthy bladder habits, and we hope that you will put this into use. And so I'm just going to finish with some tips to maintain good bladder habits, and then we'll wrap it up here. And this is all so you can improve your continence so you don't end up in a wheelchair with bed sores. But I know that's drastic and a side note, and you heard it all before, but I'm just bringing it back to why this is important, because we tend to, want immediate gratification, and this stuff is not about immediate gratification. So this is just about having good health. So here's some tips to help you maintain good bladder habits. So depending on your body size, you want to drink 6 to 8 cups of fluid a day, about 8 ounces each. Unless your doctor has advised otherwise, if you have some kidney issues or heart issues or blood pressure stuff, that is about what you want to have happen. Not enough fluid can create a foul odor of urine and dark urine. We've probably all been a little dehydrated once before and have experienced what that is to have urine that doesn't smell great. Urine, when you're like, you look in the toilet and you're like, oh, that's so yellow. I am so dehydrated. So that tells us that we need to drink more water. Some other good bladder habits would be to limit the amount of caffeine and citrus that you consume. So that's my weakness, man. I love my coffee. I could drink coffee all day. I mean, we're in a Seattle suburb, that's what we do here. But what I really advise people, caffeine is an irritant, and even tea can be an irritant. But one of the things that is not an irritant is cold brew. It tends to be less acidic, so a little bit easier for the bladder. But that was a massive side note. So caffeine and citrus foods can be associated with increasing urgency and frequency. And so that's something that you want to avoid. And if you can't avoid it, follow it with water. Alcohol will increase urgency and frequency, so really focusing on that. Alcohol also increases urine production, so that kind of confuses the brain and makes it a little bit hard to coordinate your bladder control. So it's just something to keep in mind. And then really, to have good bladder habits, you want to avoid constipation. So maintaining a good balanced diet of good fiber really can help a ton with the urinary symptoms. So bowels and urination are actually very, very related, but we'll save healthy poop techniques for another episode. So I hope you got some good tips from this incontinence episode and episode about bladder health and how to stay healthy and why this is so important. So if you have questions, please reach out to us. If you want help finding someone in your area, we can help with that too. We would love to see you here at Body Motion PT just to help you make sure that you have good bladder habits. So we do free consultations for that too. All right, take care.
The Edmonds Mom's Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.